Morning. So first I want to let folks know that we have a hard stop today at 9:15. So we'll move through our comments. Dr. Gullett and I will move through our comments, and then we'll go to questions, and we'll have a hard stop at 9:15. So I came home yesterday in the evening after work, and there was a gift from my brother on the counter. And so he said it was something that, he thought there was some perception it was hard to get, and so he got it for me and wanted me to know that he was looking out for me. So it was a roll of toilet paper. So just a little bit of humor for the day. I think there's plenty of that on the shelves. So I know there's been a lot on the social media about that. So a little bit for you this morning. I'm glad he was keeping some humor in what is becoming a very difficult situation. So having said that, I think we have a very sobering message for you today, and there's going to be a theme. The theme is that we're at a very, very critical time right now, a very critical time in how we're going to respond as a community as we look at the data, as we track the numbers, as we track critical care beds in the community, as we begin to understand what we may be facing in the coming days, and how we take to heart what the stay-at-home order says from the governor, and that's going to be at the heart of our message today. It's a very serious message for the public. So we're going to start off first by thanking Kevin Brennan, our communications officer. What Kevin does every evening is usually in the wee hours of the morning. He's putting together talking points for us and integrating messages that he thinks are key for the public to hear. So I wanted to thank Kevin for that. We try to, as Dr. Gullett has had moments of gratitude, Kevin is working triple time, and I wanted to thank him today for that. So we're going to talk about essential businesses. With the governor's order, there's a question about what essential businesses are. And so yesterday alone, independent of all the coronavirus calls we get from the public about health issues, we received 500 calls from the public about whether a business is essential. And so what it did was, with our phone bank here, it caused a lot of volume, and on top of that are the 150 to 200 calls we get around the coronavirus response relative to medical concerns. So that the important thing here is that these are all directly related to the governor's stay-at-home order. And so many of the calls were from employees who were upset that their employer had determined that their function or service is considered to be essential as defined by the order. Employees were concerned about that designation. We also received calls from business owners who want us to interpret the director's order and the governor's statements during the daily press conference. As was explained in the statement to businesses released by the governor late yesterday, the governor and the director of health want to promote and protect the health of Ohioans. And to that end, it's important that business owners keep in mind that they need to engage and discuss matters with their own team, including its lawyer and any trade associations within their entities. Each business needs to make a good faith determination on whether the business or operation, in part or in whole, is essential. Regardless of whether the business is essential or not, if work can be done from home, then have it done from home. If work can be done from home, have it done from home. Stop people in businesses from congregating together and creating chains of transmission in the community. Work at home if you can. Err on the side of caution today. Each business needs to think about this, and this good faith determination is a very critical component. Regardless of whether the business is essential or not, we think each business needs to think about the minimum number of staff on site, necessary to complete the work at its local operations. If it needs to be done on site, businesses need to take all precautions around social distancing, a minimum of 6 feet apart, proper hand washing, frequent sanitation, cleaning of surfaces, and having staff monitor their temperatures. When creating the director's order, the state was aware that it would be impossible to anticipate all the possible situations. So with that in mind, I'd ask that business owners consider the intent of this order and remember that the ultimate goal is to ensure that the maximum number of people self-isolate in their residences while those services deemed to be essential continue to be offered. The ultimate goal is to slow the spread of COVID-19 to the greatest extent possible. Business owners, supervisors, and managers should take the time to explain to their employees the reason for their determination that their business meets the criteria established in the state's order and provides an essential service. This conversation and continued open discussion with your staff can prevent many of the complaint calls we're receiving each day. Have the open conversation, err on the side of caution, work remotely if you can, minimize the number of workers on site, social distance, sanitation, temperature checks, surface cleaning. All these are part of the key formula for prevention. I'd ask anyone who feels their business is improperly remaining open, or anyone who chooses to file a complaint about what they feel are unsafe practices at a business, to please contact our office by phone at 216-201-2000 during normal business hours from 8:30 to 4:30. Please refrain from filing complaints through our website or through emails, if at all possible, so that we can continue to focus our efforts on responding to callers through our call center and working closely with our healthcare and emergency management partners on our COVID-19 response efforts. Remember that we have an information line. Our Cuyahoga County Coronavirus Helpline is 1-855-711-3035. The Ohio COVID Hotline is 1-833-4-ASK-ODH. We have to act now because there are lives in the balance. We have to act now because lives of people that we love, that we care about, our neighbors, our friends, our family members are in the balance. So we have a policy of not offering specific information about cases. And we've been doing this as long as I've been here for 30 years in public health. Our agency needs to protect the privacy of the affected individuals as we would have our own privacy protected. This is the same approach we take for someone who may be HIV positive or someone who has measles or another communicable disease. When a case is identified, that person speaks with a member of our disease investigation team, and we discuss all the places that they've been and who they may have come in contact with and what they may have been doing during that time. As a result, our disease investigators know which people need to be called and how to follow up on those who need to be contacted. This is what we do in our many types of outbreak situations, whether we're dealing with a foodborne outbreak like norovirus or salmonella, or an infection like mumps or measles. Trust us to do our job and respect the protected health information of others as you would have your health information respected. We don't want to bring about unwarranted targeting or stigma of individuals and organizations and communities, and we've already seen that. We've seen instances where people may be targeted because people are making determinations, false determinations about risk, who they think people are, and what they may be carrying. And that's very dangerous in society. It's very dangerous in a free society. And we want to discourage that, and we believe by protecting people's information, we protect their rights. If people self-identify, as some have elected to do via social media or otherwise, then the expectation of privacy is gone. However, we will still refer to that person or case as one case in our aggregate total number of cases. This all goes back to what Dr. Gullett said to all of us last week. Be kind to each other. Please do your part and participate in the need, this particular need, and try to respect the humanity in all of us. I want to talk about something I think that we're proud to report around donations that have occurred in recent days. The Cuyahoga County Emergency Operations Center reports that we've received a range of very generous donations since March 19th. We've received over 95,000, almost 96,000 gloves, almost 7,000 N95 respirators, over 1,000 surgical masks, over 550 face shields, over 56 gowns, medical gowns, over 122 containers of disinfecting wipes, and 169 containers of hand sanitizer. Incredible donations. They've came from a range of veterinarians, research labs, elective surgery centers, dental offices, and community residents. I want to thank especially MedWish, the Cleveland Municipal School District, and Cuyahoga County Community College, who have really stepped up to give us some very, very generous donations. And we know there are others out there. It makes me proud to be a Clevelander when these things happen. So keep that generosity coming. Our first responders, community health centers, senior health care institutions, and other critical providers are counting on those donations. They're already extending the life of their personal protective equipment. They're rationing their personal protective equipment. They're sharing it among each other to make sure those who are in critical need receive it. So what happens now is, in terms of donations, is we are looking at people who are at very, very minimal amounts of funding available to them, and funding available to be able to actually access personal protective equipment, which often is very scarce, and also the supplies are also very scarce. So here's what people need to donate. Here's what people need to donate. Non-latex gloves, N95 respirators, surgical masks, eye protection or face shields, isolation gowns, disinfecting wipes, and hand sanitizer. If you have these donations, take them to the Donation Reception Center at 2501 Harvard Road in Newburgh Heights from 9:30 a.m. to 2:30 p.m. Monday through Friday. I'll repeat that. If you have these donations, take them to the Donation Reception Center at 2501 Harvard Road in Newburgh Heights from 9:30 a.m. to 2:30 p.m. Monday through Friday. We'll quickly go through our standard stump speech on protection. Stay at home as much as possible. Right now, more than ever, we are at a very critical tipping point. Right now, here today, people need to stay home. They need to stop interacting and unknowingly and potentially transmitting COVID-19 to others. Right now, that has to happen. Recognize that 6-foot rule and work to socially distance wherever you can. Cough or sneeze into your elbow or into a tissue and throw it out. Those doing the cleaning, wear gloves when you're doing cleaning. All these surfaces, computer keyboards, hard surfaces need to be cleaned regularly. And don't share knives, forks, spoons, and the like. And stay at home. Please stay at home if you're sick. It's critical, again, to be part of that prevention solution. So when I wrap up here, I'd like to tell you a story on the way home recently. I stopped at a gas station to get some gas and stopped in at the counter to pay for my gas. And when I got to the counter, I didn't realize I had a Cuyahoga County Board of Health jacket on. I was driving home, and the individual at the counter, after I paid, said, put out your hand. And so I put out my hand, and she pulled a bottle of sanitizer from behind the counter and squirted it into my hand and said, you're from the Cuyahoga County Health Department. We need to keep you safe. So that message is for all of us. That young lady was looking out for me and looking out for the work that we do. This stay-at-home order from the governor and Dr. Acton is meant to protect all of us. It's meant to protect all of us, keep all of us safe. So stay at home. Businesses, err on the side of caution and stay at home or let your employees work remotely if your work is not essential. Please don't find a way, and I know there are a lot of concerns about people out of work, and that's real. That's real. Find a way to allow employees to stay home or work from home if you can at all possible, and stop the interactions that are part of the disease transmission chain. It needs to stop now. With that, I'd like to give the podium to Dr. Gulley.
Good morning. I'd like to again thank our media partners. We are very grateful for you being here. As you'll notice, it's hard for our viewers to see, but we're continuing to increase our social distancing. We've given increased distance with Heather as well behind us, and we're trying to ensure that all of you, we have fewer people that are coming into the room. We've asked our staff to please watch remotely, and we want to give you as much distance as possible. Our staff have also prepared treats for you. We really just want to continue to thank you for your service in this time. We do recognize this is a sacrifice for you to also come in, but you continue to be a critical partner in this response. I want to again begin by sharing our condolences to a second family who lost a loved one this week in our community of Cuyahoga County due to COVID-19. I want to also extend condolences on behalf of our entire staff and our team to the 6 other families across Ohio who've also lost loved ones this week. Every single time there's a loss of life, it's very personal to us. And we are absolutely determined to minimize further loss of life from this infection. But we need your help, and you're going to continue to hear us reiterate that over and over. This is a critical week for us in the state of Ohio, but particularly in Cuyahoga County and the Northeast Ohio region. I also want to preface my numbers today by saying that I and my team highly value transparency. We are doing our very best to give you as much data as we can as quickly as possible. We realize that it is confusing when you can't get all the information that you really want to be able to make sure the public knows exactly what the status of this infection is in our community. We agree. We're working with our partners in the hospitals to do our very best to give you as much information as we safely can while protecting privacy. So in the coming days, you'll see that I'm adding additional items of data to my presentation so that you can better understand the status of this infection here in our community. First, our cases today, lab-confirmed cases, 130. The age range for those cases remains at 14 to 91. The date of illness onset is February 29th to March 18th. And all of these data are related to lab-confirmed cases only. We have had 2 deaths to date in the Cuyahoga County jurisdiction. I'm also going to give you information about the number of orders of isolation and quarantine. I'm going to try to give you this on a regular basis so that you understand the scope of what our community and our team here is doing to protect the community. As of yesterday evening, we have sent out 167 orders of isolation. Those are for people who have either lab-confirmed or presumptive cases. I will remind you that a presumptive case is somebody who has been a close contact of a lab-confirmed case. Because we don't have widespread testing, those individuals cannot have testing unless they're very sick in the hospital. Therefore, we are treating them as if they have the condition once they become symptomatic, and we are further isolating them. We have sent out, as of last night, 454 orders of quarantine. Those are orders that we give individuals who are close contacts of either lab-confirmed cases or presumptive cases. We are asking those people to please stay put. Orders of isolation are always coupled with a personal phone call where we explain what isolation means and how to protect yourself and your family in your home. Orders of quarantine are also always accompanied by a personal phone call by our staff to explain to you what that means and to also give you a personal phone number to a 24/7 physician line so that should you become symptomatic, we can give you the guidance that you need to then further isolate yourself and make sure you have the supports you need in your home. We have to date discontinued isolation for 5 people with lab-confirmed cases. What that means is we have essentially given them clearance that they are through this infection based on the Centers for Disease Control and Prevention guidelines for discontinuation of isolation. I do not have any additional hospital data to present to you today, but we have a new system for obtaining hospital data which will be centralized and available to us, I am hoping, by the press conference on Friday. I will present to you both hospital data in the form of surge capacity numbers, available beds, etc., as well as lab data around percent positive in aggregate, not specific to individual hospitals, but in aggregate for our community, as soon as I feel like I can safely provide that in an accurate way. We're working very closely with our hospital partners. They've been tremendous partners through all of this, but as you can imagine, they're overwhelmed with the number of very sick cases they're dealing with, and so we're balancing trying to get accurate, transparent communications around our situation in the community to you while still making sure that we're providing the best care, and in many cases intensive care, across all of our community hospital partners. I'd like to take a moment just to remind you about some of our key strategies here. We've been getting a lot of questions, and I thought addressing it in the press conference might help alleviate some confusion and questions for the community about how this process works. When we are notified through the Ohio Disease Reporting System or through a hospital or healthcare provider of a positive infection, so either the lab or the healthcare provider identifies the infection to us, we contact that person immediately. That's why we have an entire team here working very long hours, because we, in every case possible, attempt to contact that person same day. We find out how they're doing. We ask a lot of questions about their medical history so that we can assess risk. We also talk about their home and understand their ability to isolate in that home, and we provide as much information as we can. We also obtain their close contact information. We get names and contact numbers, and then we move on to contacting those people as soon as possible. That is what initiates our orders of isolation and orders of quarantine. So if you are a close contact of a case, you will be promptly contacted by us, and we will do our very best to give you all the information you need. In some cases, we've received inquiries about people who work at certain locations or who are in a social situation with others who may have been identified as having this infection. In those cases, we identify the close contacts, but if we identify that there might have been others in attendance who don't classify as a close contact, meaning within 6 feet for a reasonable period of time, we have been crafting general messaging for those employers and those organizations, houses of worship, businesses that might have had congregate gatherings before the governor's orders came down for the stay-at-home order. So we are doing our best to ensure that everyone is contacted at the level of risk we have identified for them, and we will continue to do that. We are determined. We are absolutely determined, and we are not going to abandon this strategy. We have a solid strategy. These are what I've described as just one part of a 6, now 7-pronged strategy that continues to evolve here in Cuyahoga County in close conjunction with the Ohio Department of Health strategy. As you may have heard yesterday, Dr. Fauci at the federal level and our officials at the World Health Organization continue to underscore the approach that we're taking in contact tracing, which is the process I just described to you, as well as case identification and then contact tracing is still the cornerstone of what we're doing. Many have asked, well, this just seems like it's spreading like wildfire. Is this really worth it? Yes, it is, and we're not going to stop. But we need your help. And every time you go out for non-essential business or you congregate close to someone within 6 feet unnecessarily, you increase the potential transmission of a new route in this infection. So yes, we're determined, and yes, we're going to continue to track down every person affected by this infection and their contacts, but we need your help to minimize the number of new cases. So please, please, please heed our warnings and do not go out unless you're conducting essential business. And if you are, please do social distancing. We've got to protect our frontline workers. I'd also like to just give you a personal example. I've been dealing with this at the community level, and I'm trying to keep my finger on the pulse very closely of the state level, national level, and global level. That's my job here, to understand the context in which we are nested here in Cuyahoga County. But I also want to share with the public, and I have permission from my family to share this, that this is also impacting my own home. My husband, as I've shared, is a frontline emergency physician in one of our local emergency departments. I'm a family doctor in addition to being a public health doctor, but I'm currently detailed fully here at the Board of Health, so I'm not actually seeing patients right now. And I'd like to extend gratitude to my clinical practice partners who are covering my patients right now and ensuring they have what they need at home. But what I want to say is that we made the difficult decision to live separately right now. We are one of thousands of healthcare families who are making these decisions every day. And I share this personal anecdote to help you understand that this is what we have to do to protect our healthcare workforce and our essential workforce. If my husband becomes sick and I'm still living in the same home and our children are still living in the same home, we then have a higher risk for this infection and we become under home quarantine. And I will not be here driving the ship on this particular response. And then I have the potential of infecting my other public health colleagues. Do you see how this goes? It's a domino effect. So many of us are taking proactive strategies to separate ourselves at this time so that if we do become impacted personally in our homes, that this is something that we minimize the impact to our colleagues as well on the front lines. So many, many families have made this decision, but I want you to understand the personal nature of this. I also want to let you know that we are going to be posting more information on our website about what I'm describing to you today, so that as you sit through this press conference, it's a lot of information. You can go back and look at the process so that you don't have additional questions that you feel aren't being answered. I wanted to take one moment to speak to our healthcare partners. Again, we're working really closely with our healthcare partners. We are back and forth with them on the phone on a regular basis, multiple times a day, Terry, myself, the rest of our team. But I would really ask our partners, especially those in ambulatory and primary care, to please do your absolute best to transition your workforce home. We need you doing telehealth, telemedicine as quickly as possible. I know it's not easy. We understand the hurdles, billing and otherwise, but we've got to protect our healthcare workforce, and getting our healthcare providers who don't need to be in person with patients at home doing the care they can do at home, we've got to do that as soon as possible. I'll take a moment just to say to you that we continue to work hard on addressing long-term care and nursing home. We've identified community clusters, as I've mentioned previously, as well as nursing home clusters. And we have learned from our colleagues in Washington and other parts of the community, of the nation, and we are doing our very best to do targeted testing to minimize spread within congregate living situations. We'll continue to update you as needed from those. All of these measures and all of these approaches I've just described are to minimize spread of this infection, to minimize death from this infection. But this week is a pivotal week in the Cuyahoga County and the state of Ohio. We have got to act now. I'd like to just close my remarks by adding gratitude for a few other people. I've identified to you that I will continue to do this at each press conference. So today I'd like to recognize the Cuyahoga County Emergency Operations Center and Emergency Management teams. They have worked tirelessly in the last few days to ensure that the stockpile we received from the Strategic National Stockpile of personal protective equipment, as well as all the public donations you heard Terry talk about, have been collected in a central location and are being distributed in a way that's data-driven and equitable so that we're protecting all of our frontline staff who cannot work from home. You are public servants who are often behind the scenes and not acknowledged publicly, and we want to take this moment to do that. Thank you for all you're doing. And I would also like to acknowledge the woman named Maribel who cleans our building here. She is just tireless, and we continue to run out of toilet paper in certain bathrooms, and she stocks extra toilet paper. She's cleaning our building nonstop. We have only essential workers here in our building, and she has been an amazing partner keeping us safe and making sure that we can continue to do our job. So I hope that you're watching, and if you're not, please, if you know her, tell her thank you from the bottom of our hearts. Finally, my last point is I would like everyone listening today to please take a moment, it will only take a few minutes, to reach out to someone by telephone or by text message or by email and give them a word of encouragement. Check on them. Make sure they're doing okay. This is stressing everyone. All of our mental health is stretched right now. So please use that human touch. Check on someone today, and then please end your communication with them by giving them a word of encouragement. We will take questions at this time.
Repeatedly we've heard this is such a pivotal week. Why is this week, why is right now such a pivotal time?
The question is, why is right now such a pivotal time? So in my medical opinion, this is a pivotal time because we have a significant increase in the number of infections. And as we see influenza A going down, you've heard me talk a lot about a surge of influenza A over the last few weeks. But as influenza A infections go down, we still have a significant report of influenza-like infections. We call them ILIs in the public health world. And as those rise, we need to presume that all of those cases are COVID-19 cases. We don't have widespread testing. So with the widespread testing to ensure that these truly are those cases, we have to treat them as such. And I am seeing a significant increase in cases in this community, and we are seeing an increase in cases across the state, which you heard Dr. Acton talk about. You also see that we have an significant increase in cases in places of high density like New York City. And we have travelers from New York City in our community who we have lab confirmed case links to New York. So it's not, there's a high degree of interdependence in this community. We're highly connected. And that's why it's so important we stay at home now.
I wanted to reach out. You guys have done a lot of talking about transparency and getting us the information you can while still protecting patient privacy. A couple pieces of information we're not getting out of the Cuyahoga County Board of Health that a lot of folks in the community want to know is the age and gender of those who have died. Our most recent death, you guys aren't releasing that information. And also numbers of infection rates in cities. And I just want to say, you know, the Erie County Health Department released the gender and age of their victim. The Lucas County Health Department gave an age range and a gender. And, you know, we've got the Cleveland City Health Department here, and they're providing city level data, but folks in Parma don't get to know those numbers for those communities. So can you please explain
Sure.
why we're not getting information that our neighbors are?
Sure. So the question is, why are we not releasing age and gender of deaths and specific so our jurisdiction is the Cuyahoga County, except for the city of Cleveland, who has their own health department. So why are we not releasing city level or municipality level data? In public health, we have an ethical duty to ensure that we do not release information that could be traced back and identifiable to any individuals. What we call is we censor data. That's just a name that we use in public health when we have small numbers of cases. So one way you might have seen this in our communities around infant mortality, we will not release data on specific municipalities when we have only a few instances, for example, of infant mortality, and you've seen us do this over time. Right now, we only have 2 deaths. So if I give you the information about those 2 deaths, you're going to know who those 2 deaths were. I'm going to give you an age range, and you're going to know 2 different ages, right? If we have additional data, whenever we feel comfortable that it's not going to be identifiable, we will give you that information. But in the interest of respect for those families, I don't feel like it's fair to give when we only have 2 cases, to give information which could then identify very specifically those communities. This is, for me, an ethical issue and a privacy issue. It is not about hiding anything from the community, and I want to be clear about that. So at the municipality level, once we begin to have larger numbers of data, we can do that. But without widespread testing, I don't imagine that we're going to be able to give every single municipality numbers. It's going to be really hard to do that. So I want to be clear. I will give you everything I feel that I would be okay with if it was my family being released to the public. But right now our numbers specifically for deaths in certain municipalities are so low that it could very well, what I say up here could very well give a privacy issue for a particular family. You want to add?
So
Please, Jim.
your counterparts in Lucas County and Erie County are releasing age and gender information. Is that irresponsible? Is that compromising patient privacy there? Or are there different standards here in Cuyahoga?
So the question is, why are other local health departments releasing small numbers of data? Every local health department has to make a choice themselves about what they're comfortable releasing. I will release data as I feel comfortable around the privacy of our citizens because that's who I represent. But our other health department colleagues will have to make decisions about where they feel comfortable releasing their data.
I have a quick question.
Yes, ma'am.
I'm sure you guys heard of President Trump trying to have a hard deadline of having everything wrapped up by Easter. I'm not sure who can answer this, but how do we go back to quote unquote normal? You know, everyone's staying at home for the next week, but what happens after that? You know, I'm sure people don't feel comfortable doing exactly what they used to last week. So how do we move forward? What's the next step that you guys might suggest for people?
So the question is how do we get back to normal? When does the transition happen back to the usual way of life is the general question. And so I think what we've been doing, as we've said from the beginning, is that Governor DeWine and Dr. Acton have a playbook, the Ohio Playbook, and that playbook is designed by them and informed by infectious disease epidemiologists, internationally respected infectious disease epidemiologists, and they're watching the numbers. The data is driving decisions, as it should. The data is driving decisions. Dr. Gullett talked about the fact that we're still seeing cases grow. We've had a very, very busy week this past week, and we anticipate it's going to get busy. We know that our hospitals are going to be stressed, and so we're watching the data, and we'll continue to watch the data on cases and report them collectively, talking with our state health department and our local health department partners in Ohio. And that data will drive decisions as we talk about beginning to look when it's safe to transition, and only when it's safe. Because what we don't want is to have a lull and make decisions early without good data and then have cases continue or reignite chains of transmission in the community. So for us, the data will drive those decisions going forward.
We'll take one more question because we have to have Dr. Gullett and Commissioner Allen move on to another meeting.
Can you talk a little bit about at the state level yesterday, they were talking about the number of healthcare providers that have tested positive. How big of an issue and what kind of numbers are we seeing here in this area?
So let me explain how we identify healthcare providers. The question was, the Ohio Department of Health in their press conference, Dr. Acton talked about the number of healthcare providers who've been identified as lab-confirmed cases. and what is the situation here in our community. So we are a very healthcare rich community, meaning that we have a lot of healthcare providers with that work at large hospital systems, long-term care, first responders, and our robust emergency management system. So when a case is identified, when we do the case history, we identify what occupation that person has, including sensitive occupations like first responders and healthcare workers. We then report that information back through the state of Ohio disease reporting system for every single case. And so the data that you're seeing Dr. Acton present are coming from interviews from local health departments about those healthcare providers. I wanted everyone to understand how that information is fed from the local level back to the state level. We are tracking that information, and that's actually something that I have on the list to give expanded remarks about on Friday. We wanted to try to give you as much as we could today, but we are limited because we have some other pressing meetings that we had to do today, but that's one thing I hope to present to you. We do have the local data on our particular jurisdiction in those cases, and so I will try to provide that for you. But our data were part of what was presented with Dr. Acton yesterday, and we will be able to give you more community level data soon. I want to be clear that it's really important to understand what's happening at the state, because we're nested within the context of the state, right? Altogether, Ohio, we're in this together. But I feel like our community has been really hit with this in a pretty profound way, and so we're going to do our best to help you understand what our community situation is relative to the state. And so that's one of the elements that I think will be very helpful for our community to understand.
Can you give any numbers now, just based on what they said yesterday?
I actually cannot, because I don't have that for today, but it is one thing that Kevin and I had talked about for Friday, and I will pull those numbers for Friday. There is an immense amount of data, and we can present a lot of different angles, and I'm trying to present what's most useful to our community. So I'm not trying to hide anything from you today. I genuinely don't know off the top of my head. I know that we've had significant number of healthcare providers, and we have been working with all of our hospital partners affected by their employees who are positive. We actually have a workflow we developed last week about tracking other exposed employees as well as patients. And so that's part of our very robust contact tracing process. So I can assure the public that we are actually addressing that in a very robust way, but I will be able to give you more specific numbers on Friday.
We're going to wrap up. Dr. Gullett said something that's important and that I'm profoundly personally grateful for. Her family's making sacrifices, living apart in order to protect her family and also to protect all of us. So it's time for all of us to make sacrifices. It's time for all of us to heed the stay-at-home orders. It's time for businesses to err on the side of caution and remote work or limit the number of workers and not necessarily be out there searching for ways to be viewed as a critical infrastructure. It's time to be part of the solution. Thank you.